Spinal Truth Show weekly podcast edition. I'm your host, Dr. Caleb Slater, and here with us, Chris, a person with 2 ankles.
Yeah, I don't wear those low-cut socks anymore. Those were cool for a second when I was in school.
I never liked them.
Now it's the dad big socks is back. These aren't quite that. But
yeah, I like the mid, like in between.
Yeah.
Yeah.
You don't just give away the ankle anymore.
You're protective of it.
You got to be protective of that thing.
So this week we're going to talk about sprained ankles, and I'm kind of excited because I get an opportunity to say something isn't coming from the spine.
Really?
Yeah, almost.
Wow.
Almost.
All right, well, we'll see where this goes because I don't quite believe you.
Well, I said almost.
Yeah,
There's going to be a little
fair
but
enough.
at the end here. All right, so have you ever rolled your ankle?
Yeah, I think pretty much everyone has at some point in their life, right?
I think everybody except for my wife.
Really?
Yeah.
Which is interesting because she's a runner. I would think ankles and running.
Yeah, she still falls over, but
doesn't
for
roll the
different
ankle.
reasons.
I roll my ankle pretty often.
So a sprained ankle is very, very common, but it's also one of the poorest managed problems in the medical world.
Okay.
So what do you do if you sprain your ankle?
I think what I'm supposed to do from traditional knowledge would be I put an ice pack on it and I rest it, and if I think it's really bad, I go to the doctor, make sure it's not broken or fractured in any way.
Yeah,
and just kind of stay off of it.
So right now, basically, let's say you go to urgent care.
Okay.
Right? They do an x-ray, there's no fracture, that should be ruled out. Mm-hmm. We're doing good so far. It's what happens next is bad advice, and it keeps you from getting better quickly, because I'll explain why, but a rolled ankle, it's basically just, as long as there's not a fracture, you can walk on it, you can use it back to normal, even if there's pretty significant swelling or bruising, and I have a personal story that I can share about it, if you do the right things. The wrong things are protecting it, resting it, icing it, not moving it, and that's exactly what they tell you to do at urgent care. They'll give you an air cast, they'll give you crutches, they'll say rest it, don't put any weight on it. They put kind of the fear of God into you that you're gonna make something worse if you move it around, if you use it.
Yeah. But do you think that's a matter of them having to give you or tell you something? Like if I walk out of urgent care having spent $150 or whatever, and they're telling me, go for a walk, I feel like I'm going to feel like I got ripped off.
Yeah, but go for a walk would be a better advice.
Sure, yeah.
Yeah, I think a little bit of it too, we always advance over the years. Like things that we tell you to do now, we would have never told you to do in the past, and things we tell you not to do now, we told you to do in the past. You know, smoking at one point was actually doctor recommended for stress relief and weight loss, you know, and now that would never be the case. We were in this very they call it the RICE or the Price method, protect, rest, ice, compression, elevation, and it just doesn't work because it doesn't promote healing. And this should have been pretty easy to see, because what promotes healing in the body, Chris?
Blood flow.
Blood flow, oh my God, you got it right away. What does ice and not moving your joint do?
Prevents blood flow.
Prevents blood flow. And you can ice it if it just recently happened, you know, if it's in the first few days, icing it for 10, 15 minutes at a time is perfectly fine, but then you want to take the ice off and you want to get new oxygenated, nutrient-rich blood to that area so it can heal.
What is swelling?
Swelling is blood flow to the area, protective blood flow to the area.
So when you have a swelled up ankle, is that why you would put ice on it?
That's exactly why you would put ice on it, to manage the swelling, get that blood out of there that just kind of stays in that area, and it's not turned over as well. Okay. And now you promote newer blood to the area, helps the tissue heal.
So if you have twisted your ankle or sprained your ankle, but you don't have swelling, you don't need ice.
You don't really need ice, yeah.
But if you do have swelling, you
can use some ice, but again, to better manage the swelling, proper movement.
Gotcha. So just moving will get rid of the swelling as well.
Proper movement.
Proper movement.
All right. So when you sprain your ankle, do you know what you actually sprain?
Yeah, one of the ligaments in there.
Ligaments. So specifically, there's one in the kind of the front of your ankle called your ATFL, that's the most common, and one on the side of your ankle called your CFL, second most common. Ligaments are a stop of motion. So the ligaments, they don't have any contractile tissue to them. They just stop you from moving too far into a range, because if you were to move further, you might dislocate your ankle, you might break a bone, and if you were to do this, that creates a much bigger problem than spraining a ligament. So the ligaments, you're one of your like stop motions, okay? If you go too far too quick, you can overstretch that ligament and now it's irritated. But the cool thing is that if you just move in the opposite direction, you take pressure off that ligament, you restore motion to the joint, and now you're pretty much right back to where you were before. And ligaments, they'll take some time to heal, but unless you like significantly tore it, you're pretty much good to go. Plus, those ligaments, out of all the ligaments in the body, they're one of the least important. And to illustrate that point, a lot of professional athletes have rolled their ankle. When you roll your ankle enough or bad enough, you tear that ligament, but a lot of people don't get it repaired. Because again, it's just a stop in motion. So as long as you're not going in that direction, you're okay. If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
So is it a case of if I sprained and stretched that ligament where I now have a sprained ankle, is the rationale behind resting it so that when I continue action, like I'm not endangering myself more?
Yeah,
what's the thought
I think
there?
part of it is like what you said, they need to give you some advice. They want to make sure, like if they told you to go walk and you, I don't know, did something wrong, or you could twist it again.
Yeah.
And now those muscles are less likely to contract because you have some pain, some swelling, so you're less likely to get some muscle support. The ligaments are already overstretched and taxed,
yeah.
So they might fail more so.
Okay.
That being said, most of the time when you're rolling your ankle, it's because you were doing something, right? Like you weren't paying attention, you're walking on some uneven surface, something like that. Like it's a quick, like if you're just walking, that's not gonna happen. Additionally, when you roll your ankle, your foot goes down and in, kind of like you're pressing on a gas pedal, right? And then it rolls in. That's how you strain those ligaments, or sprain those ligaments. But if you go the opposite direction, you're putting no pressure on those ligaments, and you're restoring motion, so that's back and out. That's pretty much what walking moves you through. Your foot going back and out. If you have normal gait, your foot is actually going, your ankle is going in the right direction to restore motion.
So, okay, so you've heard the joke or whatever before where you go to the doctor and you say, "Doc, it hurts when I do this," and the doctor says, "Well, stop doing this."
Stop doing this.
So you're telling me though, I sprain my ankle, it hurts when I walk, I need to just walk through the pain?
The walking will help, but then there's some specific exercises or movements that you can do that will work you through that pain very, very quickly.
Okay, but it will be painful. Like it
will be painful initially, yeah.
All right.
So if you picture this, if your foot goes down and in, you move into one direction very quickly, a further direction than what you're supposed to. You can kind of create like a little ball of pressure on the outside of your ankle. That's where you'd have the swelling. If you picture it as like a ball of pressure, like a balloon, if you squeeze down on that balloon, you can actually get it to go away. So that's the direction that you want to move your foot. And let me tell a story that maybe illustrates this the best. So when we were starting up our business, we're working 80, 100 hours a week. My mom was living with us to help with our young children. She was on a step stool. She stepped off thinking she was on the bottom one. She wasn't. She rolled her ankle pretty bad. She didn't want to bother us. She didn't tell us, which is frustrating on a different level. She got a neighbor to come over and take her to urgent care. They did exactly what we talked about. They did an x-ray, which they should. There was no fracture. But now they did exactly what we said. They put her in an air cast. They gave her crutches. They told her not to put any weight on it. Don't walk on it. Put ice on it. I got home that night, and my mom's pretty much sitting there crying in pain, and with the patience of a son that is working 100-hour weeks, I was like, rolled my eyes, and I was like, just get up on the table, let me take a look at it. My mom didn't want me to touch it, but I immediately, I looked at it, it's swollen, it's already bruised, it looked pretty bad, but I started moving it into that direction we just talked about. I started moving it back a little bit, started moving it out a little bit, and it hurt a little bit at first, but I kept gently moving further and further into that range. It started loosening up right away, and then I had my mom do that same motion with her muscles. So she started moving her foot back and moving her foot out. Had her do that a few times, then I had her stand, and she was tentative to stand, but she stood and it didn't hurt. And then I had her start walking, same thing. She was tentative to walk, but as I got her walking, it started feeling better and better. That night, she walked right up the stairs, went to bed. The next day, she woke up and she walked 3 miles in the morning. And that should be what normal care looks like for these type of ankle sprains, but it's not. And her ankle, by the way, was still bruised pretty bad. The swelling was down, but the bruise was still pretty significant. That's going to take a while to recover. But she didn't have pain. She had full range of motion, and she could use, the more she used her foot in the proper way, the better it felt.
So, all right, that makes sense, and I'm on board with all that. But is there a common way that people get ankle sprains? Is there something common that happens that you get ankle sprains?
I mean, a big predictor for ankle sprains is previous history of ankle sprains.
Interesting.
So,
like once you
roll it, if you don't restore normal motion, normal strength, and normal proprioceptive control, then you're more likely to roll it in the future.
And I guess I probably know the answer to this, but I'll ask it anyways. Are basically all ankle sprains kind of made the same?
No and yes.
Okay.
I mean, so in a sprained ankle, you could tax the ATFL or the CFL, those two ligaments. And there's another ligament, but it's rare. You can also pull the muscle or tendon. So you can have a strained muscle or tendon. So now you have a muscular component to it too. And then the final thing, and this is what a lot of people don't realize, is that you can actually piss off a nerve. It's your peroneal or your fibular nerve, different name for the same nerve. And that pissed off nerve is why a lot of people out there still have chronic ankle pain, swelling, numbness, or tingling after they've rolled their ankle, because their ankle might have recovered, the ligament eventually recovers, the muscle tendon eventually recovers, but the nerve, a lot of times it gets pissed off, and unless you do something to take pressure off that nerve, it doesn't recover.
Would that weaken your ligaments?
What would?
If your nerve above is...
No, not really.
Okay.
It wouldn't weaken your ligaments. The nerve wouldn't innervate the muscle, which the muscle is supposed to contract and put your foot in the right position, which helps make the ligaments unnecessary.
Gotcha. But it can make it so you roll your ankle easier.
Yeah, it can make it, and, well, especially if you're in pain, right? Like if you're in pain, your muscles don't contract as readily. If you're in pain, or if you have numbness or tingling, you don't feel your body in space as well, so you're more clumsy, so to speak, right? So that's what I'm saying, like restoring normal proprioceptive kinematic control, so you're controlling your body in space, restoring full motion, restoring strength, that helps you make sure that you don't get future ankle sprains.
So you had mentioned earlier that there's athletes who will tear those ligaments and not have them repaired. Now, not most people aren't athletes, so if I were out there and I tore my ligament, what should I do? Should I get it repaired? Should I not?
In general, no. Like you don't. It's not really that valuable. Out of all the ligaments, you're good losing that guy. It's like a pinky toe.
Does it open me up to worse injuries though?
Only if you roll your ankle real bad and now you don't have that ligament to stop you. That's where you can go further and either damage the next ligament or dislocate your ankle. Again, this is rare.
That sounds painful.
Normally it's a traumatic injury.
Yeah.
Right? Like normally it's not just you stepped off the curb wrong, or you rolled your foot into a little bit of a ditch or a divot or something like that. So
I guess an ankle sprain, no matter what your age, it's kind of the same situation.
Same situation. Yeah, so, and here's something that really bothers me when I see it. It's not just urgent care that mismanages it. It's physical therapists as well, because you've never been to physical therapy for an ankle, right?
No.
One of the first things they do is they have you do what's called ABCs, or ankle four-way. ABCs is where you draw the A's, B's, C's, and so on. You draw the alphabet in the air with your foot to get motion. But in doing that, you move your foot into plantar flexion and inversion, the mechanism of injury for spraining your ankle, which also taxes those ligaments on your ankle. So you're moving your foot into a direction that's making your problem worse. And it pisses me off every time I see it. And I guarantee you, it's like most PT's go-to move.
Where does that come from?
You learn it from, it's in a commercial. I learned it from watching you, Dad. Like you learned it from the PTs who learned it from the PTs before them, who learned it from the PTs before them. This is what gets taught in school and handed down, and it eventually gets adopted as conventional wisdom, and nobody sits there and says, hey, like, isn't this the same problem? You know, isn't this doing the same thing that caused the problem? Maybe we should do a bunch of the opposite.
So if you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
So what about if my ankle is swollen, hurts, I ice it a little bit, swelling goes down a little bit, I need to start walking, but it's still painful. Would taking something like Tylenol or something like that be helpful in this scenario?
Depending on the reason for the pain. So like if it's an underlying nerve issue, no. Like
it won't change it.
It won't really change it. That you need more of like a nerve medication, like a Neurontin, gabapentin, Lyrica, stuff like that.
Gotcha.
You do want to be a little careful taking anti-inflammatories for the same reason as your body heals with blood flow. If you have an underlying injury that needs to be repaired, there are some studies out there that show that taking anti-inflammatories can actually delay the healing process. I don't think it's that big of a deal when we're talking about this injury, but it's something to think about.
Yeah.
In general, you know, I know we all want that quick fix. We all want that pill that takes all the pain away. We all want that injection that does the same thing or makes us stronger. We all, you know, laser, ultrasound, or shockwave therapy or whatever. We want something that can be done to us that makes us better. But at the end of the day, it's pretty simple. Restore motion, restore strength. And when you roll your ankle, first restore motion into moving your foot back, so dorsiflexion, moving your foot out, so eversion. Once you've restored that motion, then start to restore the strength in those ranges. So you work on your peroneal muscles, so that's the everters, and then you work on your anterior tib, that's the dorsiflexor. So like, and again, all it is just working your foot into that range and then eventually resisting your foot in that range.
Now I've seen cool people who do cool things that wear those like tight little ankle things with the hole cut for their heel. And they just, whenever they're doing cool workouts and stuff, they wear that. Is that just...
It's like an ankle brace?
I guess, yeah.
So here's the problem with an ankle brace, and this isn't maybe a great analogy, but it will definitely illustrate the point. You know those tribes that would put rings around their neck?
Yeah.
And they would keep adding to elongate their neck?
Yeah.
But then they eventually got to the point where they couldn't take those rings off because their neck was weak, because they were in a constant brace and they weren't moving it, right? The same thing happens to your ankle over time. So what happens is a lot of people, they over rely on that brace. The brace, for the most part, should be a temporary thing. Either you're trying to protect your ankle so that way it heals, but by the way, putting that brace on makes you not be able to move it back and out the direction that it needs to go. And it also makes you so that you're not contracting your muscles as well, and you're not using your proprioceptive, your kinematic sense. So like you're correcting your body in space, so your stability, right? So at a certain point, if you use that ankle brace too much, you get weaker, less stable ankles that are stiffer.
Gotcha. So my daughter is a dancer. If she, you know, it's pretty common for them to have ankle injuries and stuff and dance, but would that, if she did have an ankle, and this is me speaking, just asking, if she did have an ankle sprain, should she not do dance? Like, is that too much?
Well, so again, the mechanism of injury is your foot going down and in. She does ballet, right?
Yeah.
It's a lot of point, right? So if she did have an ankle sprain, she's one of the people that she really needs to rehab that well before she goes back, because she is really stressing that ligament at its end range.
I'm guessing there's a couple activities like that, like basketball players probably as well, with all the jumping and stuff.
Basketball is very common, and it's not necessarily the jumping, but landing on somebody's feet or stepping on something. That's how you like really roll the ankle, and it happens all the time. That being said, though, again, we talked about how these ligaments, they're not really that important. So unless she is unstable, which I kind of doubt, then I think she's fine.
Okay.
But making sure she has strength and range of motion back in the other direction, that makes it so that way she doesn't get that imbalance. Because what will happen is a lot of people, they'll be like, yeah, I sprained my ankle and now it's stiff, and they can't move their foot back, and that creates some problems.
And they'll compensate it for it?
They'll compensate, and these are people that they can't squat, right?
Gotcha.
They just fall over because their ankle isn't moving. And at a certain point, it does get harder to restore that motion. I mean, you get stiffer, scar tissue builds up, fascia binds down, it gets harder to undo a problem, so you want it treated well at the beginning.
Ankles sound like very easy to treat.
They're very easy to treat, which is why it's so frustrating that they're so mismanaged.
So if you're out there and you have an ankle sprain, it's not that complicated.
No, and I think we're putting out an ankle series, or maybe it just came out, depending on when this podcast comes out. So we're putting it out there on what you should do as long as you don't have a fracture. And this does also rely on that there's minimal muscle tendon damage.
But doing those few exercises and walking, how quickly should you see recovery or results that you are improving?
I mean, that immediately that day.
That day.
Immediately that day, you should be like, oh, my ankle feels a lot better. It might still be in pain. It might still be stiff. You might still be a little ginger on it. But but if you're doing this by day 2, day 3, your ankle is, for all your daily stuff, your ankle is 100%.
Can you tell the difference between an ankle sprain and an ankle fracture? If it happens to you?
Yeah. So there's something called Ottawa ankle rules.
Of course there is.
That help you.
Everyone knows that.
Yeah. You don't know these? That help you work through if it's a fracture.
Okay.
And it's basically pressing on 5 different common sites of a fracture and the patient's ability to walk on it.
Gotcha.
So for the most part, if you can walk on it, even though it's like a little painful, it's not fractured.
If it is fractured and you go to walk on it, it'll just give out right away?
By the time when you put pressure on it or you contract a muscle that attaches to it, it's so painful that you're just like, nope, not doing that.
It'll be like an electric shock through your, okay. I was just curious because I think that obviously you don't want to do anything if you potentially have a fracture.
Yeah, if you potentially have a fracture, one of the first things you need to do is get an x-ray to rule it out.
Yeah.
Once that's ruled out.
X-rays? I thought you hated those.
In general, yeah, you know what? So this is nice because for the most part, I tell people don't get X-rays, don't get MRIs, they're useless.
Right.
However, if there's trauma, now they're useful again.
Yeah.
And that's where they should be used. If you just have chronic pain, like you've been sitting at your desk for 5 years and your neck and elbow starts to hurt, you don't need an X-ray and MRI.
Why did this happen to me?
If you were in a car accident, and now you might need an X-ray. If you rolled your ankle, now you might need an X-ray.
All right.
Look at that. So I recommended X-rays, and I barely said that there was a spine and nerve involvement.
Yeah, there's slight nerve involvement potentially.
Potentially, and you know what? Especially if the peroneal nerve is a branch off the sciatic nerve. So if you've had an underlying sciatic problem, right? Like nerves, basically, it's pressure on the nerve anywhere in your body, like where it runs. More pressure at multiple sites puts tension on that nerve, makes that nerve more susceptible to being pulled or irritated or injured.
Yeah.
So if you've had an underlying back sciatica issue and you roll your ankle, it's very likely that you pissed off that underlying condition. And now that it gets pissed off, it might need treatment actually all the way back up at the nerve root.
Yeah.
So for people out there that, they're 6-8 weeks out from an injury, from rolling their ankle, it's still there, and especially if there's still swelling, and especially if there's numbness or tingling, because numbness or tingling has to be a nerve issue. For the most part, then you have an underlying nerve problem, and that's why you're not getting 100%. That's why you're still having these lingering issues, and so many people do. So I like to put that caveat in there.
Yeah, sure.
But for the most part, an ankle sprain is a mechanical issue. If you just protect it, from the movement that caused the injury, and you move it in the opposite direction, and you walk on it, you should be good to go.
If you do follow the traditional advice and you rest it, how long will it take to heal?
It takes a lot longer, and then by the time you get to therapy, those people suck to work on, because they're put it this way, if I put your elbow in a brace for 4 weeks, and then in your elbow perfectly fine, nothing's wrong with it, and then we took it out of that brace and we started moving around, it would hurt so bad. It would be stiff, you wouldn't want me to move it, you'd be scared about it moving because of the pain, and these people are already scared because they have a quote unquote problem.
Gotcha.
You know, so it sucks. And I actually had one guy, and this is uncommon, but I had one guy that rolled his ankle jumping at like one of those bounce places with his kids.
Bouncy Oak.
Urban Air or whatever. Rolled his ankle. I think he got an image, no fracture. They put him in a brace. He didn't move it for like 4 weeks. He developed a blood clot. Again. And he was young and fit, 35-ish, fit. He was jumping at a park. Not common, but it does show you some of the problems of not moving it. I talk about CPM machines. It's continuous passive motion machine that they used to do for total knees, and it sounded like a really, really good idea. It was, you get a total knee done, and now we really need to restore motion as quick as possible. So while you're laying there in pain, passed out or whatever, they put you in a machine that bends your knee for you. And they wanted to do this to improve healing, decrease pain, and decrease blood clots. And what they found is that it didn't help.
Why though? You're still moving it.
Because again, how do you promote healing? Blood flow. How do you get blood flow? Muscle contraction.
Oh, because you're doing the work.
Because somebody else was doing it, right? So you know what worked better than that machine? Walking.
Yeah.
Walking helped all of those areas better than that machine. The same logic can be applied to the ankle, right? Like it's another joint. You putting it in a brace and not moving it will cause problems. It'll cause more pain. It'll cause more stiffness. It'll cause scar tissue to build up in that range, and it's harder to break, So understanding what is going on when you roll your ankle, not being afraid to move it in the right direction that shortens the ligaments, that protects it, walking relatively soon, and understanding that it won't hurt and won't hurt meaning harm you, and it will actually make you better. Understanding the limitations of ice or anti-inflammatories, right? That should set a lot of people up for success.
Yeah, ankles, they're not that hard.
Yeah. Did we cover all that in this podcast?
I think so. I think if I get an ankle sprain, I think I know what to do.
Oh, I like that. There you go. And if you don't, we have that ankle sprain series.
That's right.
On our TikTok page or wherever you can go see.
Yeah,
YouTube,
wherever you want to find it.
Wherever you want to find it.
That's right.
Yeah. Any other questions on ankles, Chris?
No, just, I like to talk about the socks. It's weird how we one day show them, the next day we don't.
I got Balega socks.
What's that mean?
It's like a brand.
Oh, wow.
If I'm pronouncing it right.
Balegos?
Fancy socks. Fancy socks.
I got like Target. Don't look.
I can't do the seam. If there's a seam.
Oh, it bothers you?
Yeah.
No, it doesn't bother me. I just, the ones that real short that get stuck and go down in my shoe.
Oh, I never like those.
That really bothers me.
Yeah. I don't mind high socks though.
That's the old man way.
Like the old man,
you gotta wear shorts and you wear those high socks.
Real high socks. Not mid-calf socks. I don't like those because they just fall down.
But that's what the kids are wearing nowadays.
Well, they're stupid.
The kids are dumb.
Yeah. That shows you that they're dumb, right? Like, not that the kids are dumb, although they are, but it shows you that mid-calf socks are dumb because kids are doing it.
That's right.
Right?
I think so.
All right, we set you up for success with an ankle sprain. We disparaged children. I think
that's the goal of the show.
We've covered this week's agenda.
Yep.
So that's our show for this week. If you want to know more, if you had an injury, you can reach us at info. Had any injury, right? No. Yeah. If you want to know more about ankles, you can reach us at info@thespinaltruth.com. If you want a consult or a session with me, you can schedule via my website, thespinaltruth.com. Hit us up on Instagram, YouTube, TikTok, Spotify. We're a whole bunch of places.
Yeah, pretty much everywhere.
Stay tuned next week for a show of undetermined title.
Look forward to it.
Can't wait.